Hello everyone, my name is Olayinka Aremu. You're welcome to Health Information section with Nurse Coach Ola. So today we're going to be starting a series of the ABCs of health, and as I've promised, we're going to be talking about medical conditions alphabetically. I've received lots of requests regarding letter A, which we're starting with, but I'm going to take as much as I can. Today we're going to start with the medical condition acne. ACNE. Have you had this before? So many people have had this condition, have had it myself sometimes, and we see what is it all about? How can this be treated? What are your concerns? What are the myths, the misconceptions about acne? How can you manage it? What are the self-management approach to this? When should you contact your GP if something gets serious? So let's go. If you're watching this for the first time, please don't forget to subscribe and press the notification button and drop a comment if you can. All right, let's begin. Acne is a common skin condition that affects most people at some point or the other. It causes spots, oily skin, sometimes could be painful to touch or even hot. So acne most commonly develops on the face. This affects almost everyone with acne. Like you have it on the face, the back, and sometimes the chest. So what are the types of spots? There are 6 main types of spots caused by acne. We can have it as blackheads. These are like small black or yellowish bumps that develop on the skin. And you can have it as whiteheads. It looks similar to the blackhead, but maybe firmer and won't empty when squeezed. Unlike that of the blackheads most of the time can empty when you squeeze it. It could occur as well as papules. Papules are small red bumps that may feel tender or soft. It could also be like pustules. Pustules are like papules, but they have like a white tip in the center caused by a buildup of pus. Sometimes acne spots occurs as a nodules, large hard lumps that build up beneath the surface of the skin and can be painful. The last type of spot that an acne can cause is the cysts. So the most common type caused by acne, they are large pus-filled lumps that look similar to boils and carry the greatest risk of causing permanent scarring, which is what most people scare away from, like that scarring that comes after acne. Now, who are the most people affected? You know this yourself anyways. It's very common in the teenagers, young adults, very common among girls, especially with the ages of 14 and 17, and even with boys within the age of 16 and 19. So most people that have acne, it's like on and off for several years, and then it often disappears at a particular time and then comes back. So in some cases, acne can continue into adult life. Yes, about 5-6% of women and 1% of men have acne over the age of 25. So you might want to ask, what causes this? What causes acne? So acne is most commonly linked to changes in hormonal levels during puberty, but it can start at any age. It is caused when there are tiny holes in the skin. Our skin has some tiny holes known as hair follicles, and when these hair follicles become blocked, acne can develop. The glands are attached to the follicles. So the sebaceous gland, they are tiny glands found near the surface of the skin, and these are small holes in the skin that when an individual hair grows out, you find that. In acne, the glands begin to produce too much sebum. So sebum is oily substance produced by the sebaceous gland. Usually this helps to lubricate the hair and the skin, just to keep it from drying out. But in acne, the glands begin to produce too much sebum. So excess sebum mixes with dead skin cells, and both substances form a plug in the follicles, and this is what causes acne. So the hormones can thicken the inner lining of the hair follicle as well, and it causes the blockage of the pores So it is important that we continue to clean the skin so that it removes these blockages. So what are the other possible causes of acne? So acne is known sometimes to run in families. It could be genetic. One study has found that if both parents have acne, more likely other children, like everyone, will have it. It is found that if one or both of your parents had adult acne, you're most likely also to get acne, especially for women. There's no evidence, however, that diet, poor hygiene, or sexual activity play a role in acne, just to clear that misconception. So testosterone, sorry about that, it's also one of the causes of acne. All right, so it's a hormone that occurs during puberty. It's important for the development of the penis and testicles in boys. However, the rise in the levels of testosterone is believed to cause the gland to produce more sebum, and we have talked about how sebum causes excess sebum causes blockage in the hair follicle. There could be other triggers. I need to call your attention to this. Some cosmetic products. So you need to be mindful of the cosmetic products you use on your skin, especially on your face. Certain medications as well, such as steroid medications, lithium, and some anti-epileptic drug could cause acne. Regularly wearing items that place pressure on an affected area of your skin can also cause acne as well. Smoking has been shown to contribute to acne in older people. Now, quickly, what are the myths around acne? What acne is not? Acne is not caused by a poor diet. Acne is not caused by having dirty skin or poor hygiene. Squeezing blackheads, whitehead, and spots is not the best way to get rid of acne. Sexual activity has no influence on acne. Sunbathing, sunbeds, sun lamps does not improve the symptoms of acne, and acne is not infectious. All right, to round this up, I'm going to tell you a GP can diagnose acne by looking at the skin. Anyone, like just looking at it, you can diagnose. But in case you're worried about any skin symptoms that you have, please, you might need to contact your GP or your doctor or speak to an health care professional. So if you have any challenges, any concern regarding this, you can always consult me. You can send a request to nursegoshola at gmail.com, and then you can fill the consultation form. When do you have to seek medical advice? So if you have mild acne, you can just speak to a pharmacist. They can give you over-the-counter medicines to treat it. If this don't control your acne or it makes you feel very unhappy, then you might need to see your GP. Thank you so much. We're going to run it up on this section of health information by nursegoshola. Today we have talked about acne. The next time we'll talk about something more interesting. Do you have any comments? Do you have any medical condition you want me to talk about on this particular platform? Please send me a request, send a DM, send an email, and I'll be glad to take you. Thank you. Bye for now.